Hello, everyone. Welcome. I'm James Milan, and this is an update on COVID and other matters with our town manager as we get almost every week. I am joined by Adam Chapdelaine, Arlington's town manager. Adam, thanks for making the time.
Yeah, glad to be here. Thank you, James.
We always appreciate it. So, full agenda for our chat today. Everybody's top of everybody's mind, obviously, is what is the vaccination situation going to be moving forward here in Arlington? Are we going to be getting some more vaccines, et cetera? But let us start where we always do. Give us an update on where we are at with COVID numbers, and then we can move into what the story is with vaccinations.
So I very briefly, I'll say that December was the largest amount of virus to date in Arlington. January slightly trended behind December, and February is following that January trend. So we're not at a peak of transmission, but we're still seeing significant transmission. We're also worried about the variants that many people are likely reading about in the news. There isn't, not every sample isn't being tested for the presence of variants in the state right now, so it's hard to know just how widespread these variants might actually be. But we are worried about them, as most of them have been demonstrated to increase the transmission or to be more contagious. So again, broken record, but this is not the time to let up in cautiousness. Maintaining a mask, maintaining social distancing, staying with only those in your household remain important things for all of us to do, again, as we try to get this vaccination program rolled out.
Yeah, and even as the vaccination program does continue to roll out, we know that in coming weeks and months, we are going to continue to have to observe those protocols in order to really make this happen successfully.
Correct.
I think and hope that the Arlington population has really taken that in after your messaging and that of others for a long time. Speaking of messaging, over the last weeks, in talking both to you and to Christine Bongiorno, our Director of Health and Human Services, it has been clear that you guys have been frustrated, as we are as a citizenry here in town, with the fact that we seem ready, vaccines are not here. What is the latest on that?
So I will say, large scale, the vaccine supply does not seem to be up to speed yet. So Massachusetts and other states, they're just not getting as much vaccine as we all want, right? We all want to get vaccinated faster, but the vaccine isn't getting here yet. A notch below that, though, we do remain frustrated with the manner in which the state is viewing the role of local boards of health. I think it's been pretty widely spread that most communities are getting 100 doses a week. So Arlington's part of a regional collaborative with Lexington and Belmont. So we're getting 300 doses a week that have to be split evenly amongst those communities. And we want to be doing more. We can be doing more. As Christine probably said last week, the clinics that her and her team are putting together can vaccinate up to 1,000 people a day if we had the vaccine available. Where I wish I'd had the news to share with you right now, but we don't quite know yet, but we're hoping to learn later today or tomorrow that we'll get more vaccine next week. We understand it could be an increment of 300, 750, or 1,000 doses. Obviously, we're really hoping for that larger amount. And if that is the case, we'll publicize that and try to get as many people, 75 plus, who are on our waiting list through that clinic to get them vaccinated. So we're hoping, we're continuing to advocate. But back to that frustrating part, the state is really investing in the mass vaccination sites, which is a good thing. I'm not critical of the mass vaccination sites, but I'm not sure that I agree that investing solely in the mass vaccination sites and not really investing in or seeing a larger role for local or regional municipality run clinics is the right approach. So we'll continue to advocate. We want to be part of the team that gets more and more arms vaccinated. So we'll keep advocating. Christine is advocating through the Public Health Association in the state. I'm advocating on a weekly call on Wednesday mornings with Lieutenant Governor and Secretary of Health and Human Services, Mary Lou Sutter. So we'll keep working at it. And as vaccine becomes available, and if we receive it, we're ready to roll.
Well, we will hope that as soon as next week we have better news to share in this call. We'll keep our fingers crossed on that and check in with you. Switching gears, I understand that racial equity training for the town, which is something that was long in the works and had to be postponed, I think briefly, has now been taken up for town employees and officials once more. Talk to us about that.
Absolutely. So I think as we've talked about in the past, last January 2020, we kicked off what was to be a 5-part training with the National League of Cities Race Equity and Leadership Division to train both department heads and other supervisory staff across all town departments. We did that in January in an all-day session, and then the pandemic hit. And we kept working with the National League of Cities, and I know they, for obvious reasons, were in demand across the whole nation. But I think they finally have refined their virtual training model. So last week we did 2 half-day sessions for a total of 6 hours with that same group from January of 2020. A few new staff have come and a few people have left, so not the exact group, but the same idea, department heads and supervisory staff. And we did a refresher with some new curriculum on issues of race, equity, diversity, equity, and inclusion. So it's sort of a re-kickoff, a refresh, but also really challenged staff. I know I was challenged via some of the material, and hearing other staff and members of the team feel and think and respond to what they were learning was really powerful. So the way the National League of Cities tries to help communities move down the spectrum is through normalizing the material, organizing around, starting to dismantle systemic racism, and then operationalizing it. So really what we did last week was a refresher on the normalization, get everybody on the same page about the past and the present and where we are and how we got here. And now we're going to start to move towards that organization, and then hopefully quickly to operationalizing it so that we can start locally in dismantling systems and portions of our institution that are maintaining systemic racism. I'll add, I'm buoyed by last week. I'm also buoyed by the fact that 2 weeks ago, or maybe 3 weeks ago now, at the MMA annual meeting, the focus was almost entirely on issues of race and equity. I may have mentioned that one of the last times I sat with you. And then just this morning, I was virtually attending a group insurance commission meeting. That's the GIC through which the town gets its health insurance. And there was a half an hour section dedicated to issues of diversity, equity, and inclusion, and how they were going to be trying to become a leader in gathering data to identify health disparities by race, and then dismantling the portions of the system that allow those disparities to persist. So I'm really buoyed that locally, statewide, state agencies are all starting to talk about this issue, and it gives me hope that we can start to make real progress.
Yeah, I have to say, people always make a distinction between talking and acting, right? But this does seem to be progress in the direction from mere talk to action. You got to go through this kind of processing first, and so again, some hopeful signs there. And I appreciate the fact that you shared with us that town officials, who have experienced this training this week, really felt that it was powerful, and really it's making folks think and consider both their own actions and words, etc. But it does sound hopeful. Couple more things, Adam. One is, as I look out the window of my own home here, it's a white world out there. We've got more snow in the forecast in these coming weeks. I used to talk to you, and snow was a big deal here in town. And interestingly, just have not heard it, either from folks talking on the street, in the store, or anything like that, or, more official pronouncements or anything like that. What's going on? Is everything just going that smoothly, or what?
Well, I mean, I will start by saying I think things are going smoothly. The DPW has done a great job, working sometimes long hours, overnights over these past couple of weeks with the successive storms and snow events that we've had. This past Sunday, I know a portion of the staff had to miss the Super Bowl, or at least the beginning of the Super Bowl, with the work they were doing, and they do a great job. So I would first and foremost express thanks to them. But I'd also like to think there's a couple other things going on, right? We're not all as mobile as we were in past winters, right? So there's just less eyes on the road. But even more than that, maybe even speaking for myself, but I would imagine others are feeling this, that our perspectives have changed of what we're focused on, what we're concerned about, what's top of mind for us to be critical of. maybe now far more vast and more focused on other things than it is on the snow. So I think a lot of things are culminating into why it's not the talk of the town when it snows, but I do think that it is evidence of the good work that the DPW and their team do.
Absolutely, it is. But those last comments of yours remind me that maybe what we all might want to fondly wish for more than anything else is to get back to a time when the snow is the big thing that we're worried about.
I mean, I'm not sure that I fully agree, but yeah,
Yeah,
I'll go along
I
with
hear you.
it.
So one last thing, Adam, some surprise news this week at the select board meeting this last Monday night. The town was aware that Joe Curo, long-serving member of the select board, was not going to run for re-election this year. But he quite suddenly resigned, I think effective immediately or more or less immediately, anyway, before the end of his term. So can you do two things? One, explain to us what happens from here, literally, next week and beyond. And then also just share your own thoughts on that development.
Sure. So the board has, I believe, 30 days to fill the vacancy for the remainder of the term, so just through April. And my understanding is that the board will, at its next meeting, contemplate appointing someone to the role. I know this has happened quite a few times in the past few years, and depending on the duration of the term to be filled, I know the board has had a varying process. This is a very short term, and it's a critical term because we need to have a full board to start doing warrant article hearings for town meeting. So I think they're going to move fast and try to make an appointment at the next meeting and have someone serve at that actual next select board meeting. So I think they're looking at past members of the board who might be willing to come back and serve in this limited capacity. So I can't at all. I don't want to speak to what the board might do, but I do believe they're poised to act and get, again, someone experienced to come back and be able to help them do these warrant article hearings over the next few months. As for the development itself, I mean, I think it prompted many of us to, in an earlier fashion, talk about how we feel about Mr. Curo. He's given 9 really tremendous years to the board, and I believe 4 or 5 years to the school committee before that, and service on multiple other committees before that. And I don't think he's really, I don't think he's going anywhere in terms of his service or commitment to the town. But Joe is this tremendous mix of a compassionate, thoughtful, intelligent, and kind person that was and is a great leader for the town. So his presence on the board will absolutely be missed.
All right, thank you for that. Ton of ground to cover today. We did it as quickly as we could. Appreciate your time. We'll let you get back to work, and we'll see you next week.
Great. Thank you, James.
I have been speaking with our town manager, Adam Chapdelaine, who has given us an update on COVID and other matters this week. We thank Adam for joining us, and we thank you for joining us out there. We'll see you next week.